going to see a difference between me and some of your other speakers. First of all, I'm hearing impaired, which is no big deal, no big deal. I only hear on this side. So it's not a big deal, but because of my hearing impairment, I also have a speech impediment, which is pretty common with people with a hearing impairment. Now, what I mean when I have a speech impediment means there's many words I can't pronounce, and those words tend to be big ones. Okay, so over the years, I've learned to stay away from big words. So you won't hear a lot of big words from me. Now, what happens is, as I go around the country, this morning I was speaking to Memorial Healthcare System, about 400 or 500 people down in Fort Lauderdale, and I speak to physicians all over the country, some of the smartest people in the world. I've learned when I speak, if I get stuck, I can't stop. So you're seeing my hand going right now. That means I hit a little stop a little while ago. So now I have to sort of say, you know, Rolodex, look at a word. This is one you can pronounce. Stay away from that word, and so on. But periodically my brain, and this is why I think I need artificial intelligence, my brain and my mouth don't connect. So my brain thinks I can pronounce a word, and I throw it out there, but I can't. But when it comes out different than I meant it to come out. Like today I was talking to a guy, and I wanted to tell him kudos. And I kept saying, you've had a lot of kudos. I couldn't pronounce it. And I said, you know, good stuff, good stuff, good stuff. And then I got it later on. But I speak a lot to healthcare organizations, very smart people. I'm going to be at the hospice tomorrow morning. And when I speak, I keep right on going. Because if I stop, I can't start. But even that's been an advantage for me. Because I have these really smart people, and they sit in the audience, and they're thinking, I've never heard that word before. This guy is really smart. The other thing, it's my books. My books do extremely well. My book, Hardwiring Excellence, has now over 700,000 copies. Most healthcare books, 600, so it puts it into perspective. And it's very interesting because people come up to me and they say, you know, I really like your book. It's easy to read. And I want to say, well, that's because it's a 6th grade reading level. Because I write at the 6th grade reading level, and because that's just who I am. So here's something I thought was an obstacle, became an opportunity. Can't hear, I can listen pretty well because I have to pay attention. Speech impediment taught me to continue to do difficult things, because part of doing anything in life is it's difficult. And if we keep doing it more often, we get better. I was forced to do difficult things, and here I thought being able to write at the 6.2 grade reading level would be a detriment, and it really makes books easy to read. Because I think a lot of authors write a book and they're more worried about do they sound smart than do people understand what I'm writing. And so that's really the goal here. Now, let me talk about what I'd like you to leave with, if possible. And first of all, we got a lot of healthcare providers here. Who are the healthcare providers here? Okay. Be kind to these people, okay? Because, it's like anything else. And seriously, if you treat other people nice, they sort of treat you nice. I had to explain this to my dad, because my dad's one of the worst healthcare consumers in the history. And my dad I'd call my dad, because he's going to go to the doctor, and I'd say, what did the doctor say? Now, you got to excuse the language. He says, not a damn thing. Don't know what the hell's going on. They don't tell me nothing. So anyway, I called my dad one day, and I said, what's going on today? Because I'm going to the doctor. I don't know why the hell he says hell in a lot of words. I don't know why the hell I'm going to the doctor. He's not going to tell me a damn thing. And I said, don't think that he's looking at the schedule right now with great excitement. Don't think they're saying, we can't wait for him to come in today. So if you really want to make his day, cancel. He'll be excited. Because it's pretty interesting, because, we've all realized this. If I treat the waitress nice, they're going to treat me a little better. I bartended when I was young, and I could behavioral mod people unbelievable. I'd come in, he'd be a little rude, he'd want a beer, I'd just look at him. A little while later, he'd be a little more polite. I'd look at him. A little while later, he'd say, sir, could I please have a beer? So I guess the main message is truly don't be afraid to be nice to your healthcare provider. If your doctor explains something to your nurse, thank them for explaining it. If they tell you about side effects, say that's really helpful. Like anything else, behavior that gets rewarded and recognized gets repeated. Even healthcare providers need to hear good things because I truly believe they do very, very good work, and they really do every single day try to do good work. And I've noticed this. My dad's 93. Went to the doctor with him 2 weeks ago, and I watched his doctor work with him. And I watched my dad at 93 put his head down, and the doctor said, you know, what's wrong? And he said, I'm so disappointed in myself that I can't feel better. And the doctor spent time explaining to him that at 93 there's going to be some good days and some not so good days. But he tried to explain the reality of what was going on, and he was very, very kind. But my dad also was very appreciative because he's learned over the years that his old technique didn't work quite as well as the new one. So that's my main message, but that's not why we're here. Why we're here today is talk about how to be a better healthcare consumer. Because I actually believe we're not aggressive enough in the healthcare environment. I don't know if we're intimidated by it, scared of it, but we just sort of handle it different than we handle other things. For example, if we go to buy a car, we do great research. If we go to pick a doctor, we might not do the same research. My wife owns an olive oil store, but before she buys anything, she does unbelievable research into things like what type of olive oil to buy. So one of the things is, any good healthcare provider wants you to be a good consumer. It only helps the healthcare provider for you to have knowledge. Now, there's a period we all went through when we get a little frustrated because I don't know about you, but I'm a man, and when I go to the physician, I go to him for a second opinion. I've already diagnosed myself. Any of you ladies have a man who diagnoses himself? Do you notice we're a little extreme in our diagnosis? You ever notice when a man gets a headache, it's not a headache, it's a tumor? You know, I don't get a stomach ache, I have colon cancer. I'm always thinking the worst, the morbid projection and so on. The other thing I've learned about men is we're a little more vocal when we don't feel good than women. I don't know if anybody else has noticed that. Like when I don't feel good, I actually will wake up my wife at night. I'll wake her up and she'll say, what is it? And I said, I don't feel good. She'll say, what's wrong? I'll say, my throat. My throat's a little scratchy. I think I have a fever. And I'm not happy unless she touches my head. Now, I've learned over the years that sometimes she touches it a little faster and a little harder. In fact, some nights I think she thinks I'm sick because all of a sudden I get one of those. And then she'll say some real fighting words, men. And you know what our fighting words are with women? When they say, I know how you feel. No woman knows how we feel. Nobody's ever had a flu like we've had the flu. Nobody's ever had a headache like we've had a headache. So she'll say, I know how you feel. And I'm going to, of course, challenge her on this. And I'll say, how do you know how I feel? She said, I've had it all last week. And I'll say, gee, I didn't know that. Because, of course, she doesn't say anything. So we're talking about being a good consumer here. We're also talking about how to be informed. Now, there's going to be some people that won't like some of the websites, but you're smart enough to know you go to different websites for different things. There's some great information out there. So I'm going to break my talk into how to go to a doctor's office and maximize the doctor's visit. I'm going to talk about how to get any health care and take advantage of the health care you get, because as long as you're there, you might as well take advantage of it. I think, too, for physicians and healthcare providers, the better consumer we are, the better for them. The more prepared we are when we come to an appointment, the more we can help them. So we're going to give you some tips on that. Then I'm going to give you some websites and show you a couple samples of how you can, before you go to a doctor, particularly, or a hospital, more specifically, is how you can sort of know the care. In fact, you will see that. and you will see I took 2 organizations. I don't know who they are. They're blinded. I had my staff pick 2 healthcare providers in Ocala, and I can tell you, not knowing who they are, before I showed up in one, I would find out. And I will sort of show you what that looks like. So let's talk about how to maximize your next appointment. And I included some things in your packet. Please duplicate it, do whatever you want. Now, some organizations today will give you access. For example, Memorial in Hollywood, Florida, and you might have that here. When you're a patient, they now give you a code, and you can go into your medical records in Fort Lauderdale, Florida. You can probably do that here, depending on how sophisticated they are. And you can go in and you can access now your medical records, your electronic health records, and you can see what they're writing about you. You can get access, which is really, really important. But some places don't, and certainly sometimes physician offices won't yet. So we're going to talk a little bit about physician offices, and we're going to talk about a patient-physician guide. Now, in our guide, what we want to do, it allows you to be an active participant in your care because we want it to be collaborative. We're going to provide you a tangible record so when you leave, you know what's going on. And it also helps the physician's office because they get phone calls. Physicians get phone calls from patients that leave that say, what was my blood pressure again? You know, what was I supposed to do? What was my medication? What was my follow-up visit? So we will actually help them by save them some time, which is good. Because time that they save, they can see other people. Because one of the biggest challenges in healthcare today is access. It's getting in. Well, we can help create access by being a good consumer and being a good patient. We want to summarize the key aspects of what we're finding out, and we're also going to make sure it's adaptable if there is electronic health record. So what we want to do is go through this guide, and it's going to sort of help us understand what are our vital signs, what are their provider notes, what's our medication, what's our follow-up care, and some post-visitor care expectations. So on your chair, and you can take this with you and copy it as much as you want, is a guide that we recommend that you take with you to the physician's office, the nurse practitioner's office, and so on. Now, you can change it if you would like. By the way, when we present this to physician offices, this is one of the tools they like. They actually will start utilizing it because what it does is save them time. So when you go to the doctor, you can already have filled in why you're primarily there, what questions you might have. You can talk about what you would like to leave with. The other thing the record will do is talk about vital signs, because you might not remember. You might not take that little card, so you know your vital signs. You can ask them to put notes on it if you would like, and they're not going to put the type of notes they're going to put in their health record, but they'll put a few notes in there so you know the most important things. Medication instructions. 66% of the people that leave an ER and come back because they haven't done their medication correctly, because they don't understand what they should do or shouldn't do. My father's a perfect example. My father was dehydrated one time, ended up on an ambulance, ended up going to a hospital. The reason was he wanted to get better. So they gave him medication, and he said, I really want this to work good, so I will take it on an empty stomach, because that makes sense to me. I'll really charge up here. Well, of course, what it got him is nausea. He couldn't eat, and so on, and these things happen. And, you know, it happened to me. I got a medication one time, and I had a reaction. It was to sulfa, and I broke out, and I got sweaty. And me being this is when I was in my 30s, being not a great consumer, I'm so silly, I thought, this stuff is really working good. It's sucking that infection right out of me. Look at this. So I went and took a couple more sulfa pills. I called the doctor, and I said, Doctor, let me explain what's going on. And he said, whoa, you're having an allergic reaction. I said, let me tell you after I took the second dose. He said, why would you take the second dose? So this whole medication issue is vital. And the other thing to realize is there's really very few medications, maybe none, that don't have a side effect. Everything that's good also can have a side effect. they can also work against each other. So one of the best things you can do when you go to your provider, and most of you do it today, is bring a complete list of all your medications, when you take them, and so on, because the physician can review them, and particularly if you're trying to get them from different places, it just doesn't work. So they're talk now, are there any changes in my medication, or I'm staying the same? Then we talk about instructions. One of the biggest frustrations for healthcare providers is when they get blamed for a non-compliant patient. Are there any physicians here? You know, you treat a patient, you give them a pretty good treatment plan, and they leave. And then they don't follow it, and then they say, the doc's no good. Didn't help me. Pardon?
Or a lawsuit.
Yeah, or a lawsuit. Didn't get better, or so on. Okay? So the reality is we need to be compliant, because if we're compliant, we'll have a better outcome. But we got to understand what compliance is, and that's following these instructions, whether it's taking the medication till you're completely done, how you take it, and so on. Now we also want to know about follow-up care. What should we do next? Once again, my father goes to the doctor, comes back. I said, what'd the doctor say? He handed me a form. Now I know. I knew the follow-up. I knew what he should do. I knew exactly what was going on. Should they schedule an appointment with the primary care doctor? When should they schedule an appointment? And what are some post-visit expectations? So what we're talking about now is test results, which is we're going to talk in a little bit about duration, which is crucial. Now, this might sound no big deal, but if you take this form with you and you go to the physician and you walk through the appointment with it, you will be a better consumer, but most importantly, you will get better care, and most vital, you will help your healthcare provider, because you're really in a collaborative operation here. You're trying to collaborate on your care, not have one person in charge of it. You're both trying to take ownership. So that's called a patient visit guide. You can change it, rearrange it, but that's what this is. So let me talk about what to listen for from your healthcare provider, because I'm concerned about your anxiety. Now, we go at this at Studer Group both ways. We're telling you what to listen for, because then the healthcare provider, we believe, should be giving that to you. And we want you to be a good consumer, because then the healthcare provider will want to be better. If they want to be better, they might even hire the Studer Group to help them get better. So, you know, we can go at this from both angles. So let me talk about what to listen for. Now, there's a couple key things, and these are called the 5 steps of communication. Now, if you're in an inpatient hospital setting, you want to make sure they acknowledge you by name. Reason is you want to make sure you're the right patient for that, what they're being treated. Now, if you're in an outpatient area, it's not near as important. I don't get hung up if they get my name right, as long as I get in. But the other 3 things are most important to listen to. A good healthcare provider will introduce themselves a little differently than others. They will tell you not only their name, but they will tell you their experience. They will tell you their education, not to brag, but to help you feel better. Because when a physician or a nurse practitioner or anybody explains to you that they have a lot of experience, you immediately reduce your anxiety. When you reduce your anxiety, you're a better patient. My family practitioner, Dr. Anita Westifer, takes my vitals when I come in, and she takes them when I leave. Because she says she finds when she takes a patient first gets there, the blood pressure is higher. And when they leave, it's lower. So she takes it both times. So you want to listen for a healthcare consumer to see if they tell you that. If they don't tell you that, don't be afraid to ask. I was referred to a dermatologist because I had a spot on my cheek, and he told me I had what looked like some skin cancer. And they did a biopsy, and then he went to operate. Now, I went to him completely on a recommendation from somebody else that said he was really good. But I didn't realize we were going to do cutting. So he sits there, and I'm sitting there, and he's got a knife in my mind, and I got a face. And I'm actually stalling a little bit, I think. And I said, can I ask you a few questions? Where'd you go to medical school? He said, I went to Vanderbilt. And I said, then I did a residency and a fellowship at Vanderbilt. Vanderbilt's a very good school. You know what I'm thinking? Good. You know what I said to him? You need to tell everybody this because you want to reduce anxiety. Don't be afraid to ask people about experience. Heck, I remember taking my daughter's car. I took it to Walmart. They had one of those, like a person that saw your car, then he tells you where to go. I didn't know it was a bad battery or an alternator. I was sort of debating, and I had a trust issue because I thought they'd probably tell me alternator because I don't know, and it's a little more expensive. You're probably not skeptical about healthcare providers and finances, but I was a little skeptical about whether they would send me to the most expensive thing. So this guy's got his auto mechanic type garb on, and it says John. So I say, John, how long have you worked here? He said, my first week. Thinking, okay. I said, what'd you do before you here? He said, I was in a NASCAR pit crew. He said, for 23 years, I worked for NASCAR. I said, why aren't you still working for me? He said, my wife didn't want me to be on the road, so I got this job at Walmart. He could have told me anything about my car. I wanted him to autograph my car. But it's that introduction that helps me reduce my anxiety. The reality is most healthcare providers have experience, but we might not know it. So the more we can ask and get their experience, it'll help us feel better about the care. There's nothing wrong with that. Next is duration. Don't be afraid to ask how long something will take. Once again, I'm in the room, he's going to cut on me. I said, could I ask you a question? He said, yes. I said, how long is this going to take? He said, about 45 minutes. I had to go to the bathroom. I said, could I go to the bathroom first? She said, sure, but it's different. See, my sister just got diagnosed with stage 3 pancreatic cancer 3 weeks ago. And she's today at the Moffitt Cancer Center getting her first treatment of chemotherapy. One of her biggest concerns is when they did the biopsy where she lives, they said, we're going to do a biopsy. What she never asked is, when do I get it back? So she sat there with unbelievable anxiety for days waiting to get something back. What they had done is actually sent it out when they saw that it could be pancreatic cancer to get a second reading. They did all the right steps, but they didn't do all the right communication. So don't be afraid to ask how long something will take, when you will get it back, when you will hear. It helps you and it helps them. Again, I went to the primary care doctor one time. She sent me to the radiologist. The radiologist did a test on me for my stomach, and I was nervous. On Monday, I called Dr. Westifer, and they gave me some bad news. She's off on Mondays. Tuesdays, I call her, and she says, oh, didn't the radiologist tell you? I told them to tell you, but they weren't comfortable. But see, I needed to know that, because if I would have been asked about that ahead of time, I would have said, Anita, do you know when I'm going to get my results back? If she would have said, you know what, I'm going to tell the radiologist to give them to you right now, out of knowing that. Don't be afraid to ask for how long things are going to take, when you're going to hear it, and if you don't hear it, should you call back? Because sometimes they even think you're calling in. All we're trying to do is get on the same page. Believe me, your healthcare provider wants to be on your page. They don't want to be difficult. They want to work with you because they want the best clinical outcome you can possibly get. Next is explanation. Don't be afraid to ask for an explanation. What are you going to do? Why are you going to do it? How are you going to do it? We do a lot of videotaping. We're at Sharp Healthcare, and we watched a person get a cardiac cath. And all of a sudden, they came in, and they put oxygen on the patient, and you could see the eyes go like this. So we stepped back, and we explained maybe there's a better way to do this. And one of the things was everybody introduced themselves before the cardiac cath. So let me tell you who's in the room. They talked how long things are going to take, and they said, let me explain what we're going to do. And they said, now we're going to put oxygen on you, and we do this with all the patients. But before we do you have any questions? You could see the anxiety go down. Do not be afraid as a consumer to also ask about explanation. Why are we doing this again? What are we going to do? How are we going to do it? Is this normal? And so on. We have every right to be a good consumer, and any good provider wants us to be a good consumer. The better we're on the same page, the more compliant we are. So other things to expect from your healthcare provider. A pre-call. Many healthcare providers today know the worst thing that can happen to them is a canceled appointment. So doctor's got a canceled appointment, he'll never make this back up because that's a spot that somebody else could have came in. So what you're going to find is many people will call you to confirm the appointment. And when they call you to confirm the appointment, they should also go over where to go. They should tell you what to bring. Bring your medications. They also should tell you your copay, because that helps you be prepared when you come to see the doctor. That's called a pre-call. Many providers today are doing a pre-call. Now, why does it work for them? It reduces canceled appointments. If you have a pre-call, it reduces canceled appointments by 70%. It reduces tardies by 60%. Those canceled appointments that get reduced help anybody be more productive in the workplace. And also, again, we can keep people on time. If you're wondering why you're waiting in a waiting room, sometimes it's because we overbook because we have no-shows. Well, if we knew we weren't going to have no-shows, we wouldn't overbook because all of a sudden we don't want to not have people there. The other thing that happens why you might be late is somebody might be late before you. And if other people are late, it throws everybody off. And of course, doctor, if the rest of your world isn't working well around you, you get delayed. And they look at you, not the rest of the people. So many times a physician is not the one driving the late bus. It's the people that are interacting with the physician. Now, the most important things is the post-call. Now, you will not get a post-call from the physician most of the time, but we're seeing some physicians doing post-calls, particularly to people they think might not totally understand the medication or might not understand exactly what to do when they get home. But every hospital in the United States should do a post-call. You should get a post-call. And what they want to know is, how you doing? Do you have any additional questions? They want to check how you're doing, and they really want to go over your discharge instructions and medications. So this is good, because here's what they have found out. Patients that get a post-discharge phone call are less likely to be readmitted to the hospital. Why? Because now they understand what they should do or shouldn't do, or they can get better home care instructions. So if you get health care in this area, when you leave, particularly a hospital or emergency department, you should expect a post-call. If you don't, you should look at, is that the provider that you want to be with? Because you want to be a good consumer. And you are pretty good consumers. In fact, by the way, I've been looking at the wine consumption. You read that article on Heart Healthy, didn't you? We've got a healthy little group here tonight. The reality is, with the tremendous pay cuts and reimbursement issues that most healthcare providers are facing, they want to see patients. They really, truly do. And they want to see patients particularly that have a payment mechanism that will help them. So they want you to come see them. They want to take care of you. So don't be afraid to be a good consumer. And you should expect a post-phone call. Our recommendation to organizations is schedule it before you leave. Because, see, they don't know when to call you. Tell them, I'll be on my cell phone. I'll be at my daughter's house. This is the best way to get a hold of me, because they do want to get a hold of you. So let's look for what to look for in a hospital stay. So when you're going into a hospital stay, and we're all going to be in them. We're all going to be in them. It's not a matter normally of if, it's a matter of when at a certain time. So what are some things you should look about? We work a lot, and here's the things that you should be looking for. The better organizations, the nurse should go over with you, your staff should go with you every shift change about what's going to happen with your care while they're on work. They call it a bedside shift report. They should introduce you to your new nurse. Better healthcare organizations, when you have a shift change, the nurse coming in introduces you, the nurse leaving introduces you to the nurse coming in. Why? Doing a transcription, transcribing a patient, having another nurse listen to it, isn't about answering questions. We work a lot with great healthcare providers. All of them have gone to face-to-face bedside shift report. So you should expect your nurse that's leaving to introduce you to your new nurse. I remember my wife had her first baby, we're in this labor, going through this whole dilation deal, and we're going, and the nurse would come in and say, you're a 7, you're an 8, you're a 9. We get up to like that 8, 9, and also the nurse comes in, and I'm thinking they're going to give us an update, and she said to my wife, I'm going to be going home now. My wife looked at her like, don't leave. She looked like me, like, pay this lady to stay. Now, if that nurse would have came in and said, I'm going to be leaving to see my family, but let me introduce you to who's taken my place, it's a whole different ballgame. Sometimes if I can't do it in person, I should do it verbally. If I'm a primary care physician, I'm referring you to a specialist, I should tell you why I'm referring you to that specialist. I'm sending you to this doctor because I know him. He's well trained. He does this procedure. You know what they can say to reduce your anxiety? This is who I would go to. This is who I would send my family to. So they should introduce the new nurse. They should go over your daily care for you understand it. And most of all, you should have a whiteboard in your room, and they should update medication changes. They should update. We put an M with a circle, means there's been a medication change since the last shift, so your family can know it. It's called bedside shift report. Patients that have bedside shift reports that get these rank their care in the top 10 percentile of the country. Those that get 3 out of the 4 in the 75th percentile, and so on. These are things to look for as a good consumer. A couple other key things is explanation of medications. Again, if you're having an excellent health care, they're not only giving you the prescription, but they're going over side effects. In fact, most organizations today, and the best way to do this, if you can, is for the healthcare provider to ask you to explain the side effects. I'm going to explain the side effects to you. I'd like you to explain them back to me. If in a hospital setting, we want you to, now most hospitals give you the medication you're on. They give you a sheet explaining it and the side effects. And the best way to find out side effects is to ask the patient, now you explain the side effects to me. And the other part, of course, is hand washing. It was sort of interesting. When we won the Malcolm Baldrige Award, we won it with a barbecue restaurant out of Texas. And they asked this barbecue restaurant guy, a lot of hospital people, they said, what do you do with an employee that doesn't wash their hands? And he said, we fire them. Food safety is important. And all of us in healthcare went, oh, we don't do as good a job washing our hands. Don't be afraid to say to your caregiver, have you washed your hands? They might have, but if not, don't be afraid to ask them that. Because again, it's your body. It's what you're taking care of, and infections are one of the key things. So let me talk about some other things as I close, because I'm on a real time. By the way, I want to say how lucky you are in Ocala to have IHMC. Yeah. You're very fortunate. I mean, it's one of those things, and I know you know this, but it's one of those things that when you have it, sometimes you don't know how good it is until you don't have it. And to have an organization that brings this much intellectual capital into Ocala, this many brilliant people, is really marvelous. The fact that you and your sponsors go out to provide this is really not common. There's only probably 2 cities in the United States that do this, and luckily they both have IHMC. So I just want to tell you, I'm a great admirer of Dr. Ford and the brilliance that you have here. Now, do I understand what they're telling me? Not most of the time. They got to dummy it up a little bit for me. But otherwise, I think you're very fortunate. So let's talk now, as we end, about what you can do. I have given you a number of websites. That you can go to, and they're up and running again. Anyway, a number of websites that you can go to. Now, are these the be-all? No. The best way to still find out about healthcare is ask people who have had the healthcare, ask people who have gone to that doctor, ask people who have been treated by that hospice. Word of mouth, like anything else, is still an extremely valuable thing when you're picking any type of service. But these are the various healthcare websites. Let me show you what you can get from them, because it's pretty interesting. You can go in and you can basically tell where you live, and you can basically tell what type of payment you are. You can literally go in and you can find out readmission issues, where there are complications at that hospital. You can find out where there are deaths at that hospital. You can find out how much imaging. You can find out the number of, by the way, frequency is good. It's the more people that you see, the better you are. Doctor, what type of physician are you? Eye surgeon. You know, how long you been an eye surgeon? 20 years. You are better at 20 years than you were at 1 year. And it's cut about frequency. It's called frequency. Now, not that you can't be good when you don't have it, but the more you have it, the better you get. So basically what we're looking at here is you can go in and you can find some things out. Now, you can find out about core measures. So, for example, in Ocala, and I don't know which area, we have Hospital 1 and Hospital 2. Now, sure, they're both pretty good, but would you rather get a place, outpatients having surgery who got an antibiotic at the right time within 1 hour before surgery? One of them is 100%, one is 97%. Surgery patients who were given an antibiotic at the right time to help prevent infection, 100 versus 96. Surgery patients prevented antibiotics were stopped at the right time, 100 versus 96. Patients who got treatment at the right time to help prevent blood clots, certain type of surgery, 100 or 98. Now, 96, 97, and 98 is pretty good, but which place would you rather be? I'd rather be in the 100, wouldn't you? Now, here's what I've learned about healthcare providers. If the data makes them look good, it's valid and reliable data. If they don't, something's wrong with the data. Okay? But the reality is you have this. You have this now for hospitals. Why not use it? We use it for cars. We use it for refrigerators. We use it for everything else. Consumer Report now talks about emergency departments across the country. You go on Consumer Report and you can find out about emergency rooms. Let's talk about patient experience. This is patient experience. Now, this tells you how pain's being managed, how people are getting communicated to, if people know about medications. So what this shows here is, if you look at, in Florida, your two healthcare organizations, if you look at them, one of them is a little bit above average in Florida, and one of them is a little bit higher on recommendation. If you look at them in 9s and 10s, which is the key thing, they're both about the same, the 68th percentile, a little better than the Florida average, a little worse than the national average. Now, if I'm a healthcare provider, I look at this and I say, whoa, here's where I can sort of help, do a little bit better. Patients who reported they always received care as soon as they wanted. Here in Ocala, you're at the 60, 61, and 60th percentile. And the average is 61, and the average in the U.S. is 67. That might be something I look around and say, what's happening in the United States that I could get a little bit better in? So what I'm trying to say is, in patient experience, you're basically about average in the Ocala area, but you can look at it. Now, there's an area here I thought you can look at one place. The doctors communicate a little better. Nurses are about the same. Patients' pain is reported about the same. So if you look at patient experience, your organizations are pretty equal. Now, there's one that's much quieter than the others, and there's one that gives information during the recovery time at home. So they're both about even. They're both about even. We have Deborah Cardello, who's in Deborah. Deborah was at Robert Wood Johnson when they won the Malcolm Baldrige Award. Now she lives in this area, and we're lucky enough because she works at Studer Group. So you can even go in and see how do they do these things. The last thing you can do is why not the best. You can go in, now this is Escambia County, so this is where I live, and you can go in and type in the hospital, and you can find out how they do in various certain clinical outcomes. For example, here you can say overall recommendation of care, higher number the better. Overall heart attack care, one's a 98.6 and one's a 99.5. Now you might not think that's a big difference, but I would like that difference. I would take it. I would go to the best if I could. You see pneumonia care, one's different. And if you look at it, that's sort of different and with surgical care. All I'm saying is I can't give you the answers, but I think there's methods out there for you to get the answers. And that's really what we wanted to talk about today. We wanted to give you a patient visit guide, which helps you manage, because you're really the navigator. We talk about these government navigators. Well, that's navigating how to pick a healthcare exchange. The biggest navigator is you, because you're the navigator of your own health care. So I wanted to talk about a patient visit guide that you can use. Number 2, I want to talk things to listen for. Introduction of skill set, experience, introduction of the next caregiver. Make sure you ask duration. Even how long should I take this medication before it works? I was very lucky. I was on the road and I got sick and I stopped at an urgent care center. Physician sat down with me and told me that what I have was probably going to be I had a 5-day virus and I was in my 4th day. He said he can give me some medication which will help me when I don't need it anymore. But he said, truly, if you can gut this out for another day, you'll probably be okay. I like that. I like that type of conversation with him. So, because I thought if I take medication, it's going to be a miracle. He said, it's got to work through my system. Healthcare providers are good if we're good working with them. And that's really what this is all about. I wanted to also then show you that you can also go online and you can truly get more information than you've ever thought possible, and you can be sort of the navigator to get the best care you can. Your healthcare provider wants you to be a good consumer, because if you're a good consumer, you'll make good selection. And you know, doctor, I have this gut feeling if I lived in this town and I needed eye surgery, you're one of those people I would pick, because you know what? You're here. So, thank you very much for allowing me to be here for my 45 minutes. I appreciate it. Do you have any questions? We have one in the back here, and we're going to get you a mic. Because remember, I might even need an interpreter because I don't hear it. And if I do not want to answer it, I'll just act like I didn't hear it.
One of your comments was, why not pick the best after you do the research? And you're the navigator. And sometimes the navigator's the insurance company, and you don't have the option. How do you get around that?
Well, I think when the navigator's the insurance company, they're going to give you, normally they're going to give you a panel. Very rarely do they tell you it's just this person, it's a panel. And I think then you can go on and you can work with the panel. I mean, very few insurance providers say this is the only doctor you can see. This is the only hospital you can see. They're normally a panel. And I think you can work with the panel. The other thing is, insurance providers, by the way, also are committed. Truly, they don't want to have people that aren't very good in their panel. Let's talk about that. And you might think, oh my God, the guy's an advocate of insurance providers. Let me give you an explanation. CalPERS in California probably manages more care than most. They looked at total hips of all their members, and they found out that they had 128 different providers that provided hip surgery. And the price ranged from $30,000 to $128,000. And what they found is they had a number of providers that were lower cost, that were high quality. So what they did is they give their members 4 options. Option number 1 is high quality, low cost. You go there, you pay nothing. Option 2 is high quality, a little higher cost. You pay the differential. Same quality, you choose. Third option is low quality, high cost. You pay. Low quality, low cost. You pay. I believe there's enough data because it doesn't help an insurance provider for you not to go to a good physician, a good provider, and so on. And the old days of just lowest cost, I think that's going away because there's too much transparency. In Canada, for example, even on the websites, they have to share where their comparison is. So I'm not beating on the insurance companies near as much as most. I think they're trying to be into it too to make sure people get good care. So normally they give you a panel. You know what, you're gonna have to do a mic, I'm sorry. Plus you look like you'd do good with the mic. Have you ever sang?
My name's Sam Baggett. I've spent many years in the nuclear business, and I will make the statement that the nuclear industry, after 3 Mile Island, corrected their business of human performance. what you discussed tonight is just scratching the surface of what can be done. But the medical community in general has rejected going to other industries, it seems like, to find this expertise and techniques and stuff like that. In fact, our guru of human performance offered to give our local hospital free seminars on techniques that really work and proven techniques, and got categorically rejected. Now, I would suggest to you to go to IMPO or look at this aspect, because some of the things that you mentioned tonight have been highly developed and it could be easily transferred over to the medical community.
Interesting you say that, because actually what's happening right now is healthcare is actually looking at nuclear, the nuclear reactor.
Checked in a lot of places, I found no one that's been pursuing this.
Yeah, drop me an email, quint@studergroup.com, and I'll send you some places. I'll actually send you some books that are being written for healthcare by people from that field, and I think you're absolutely right. The challenge we've had in healthcare is too much variance, and what you did is you reduced variance. And the challenge in healthcare is there's too much variance. And what's happening in healthcare, and you might not like it or dislike it, but it's going to reduce the variance. So for example, if you look at evidence-based medicine and the RAND report, only 54% of the physicians truly follow evidence-based medicine. It means research that shows when you use this antibiotic, you will get a better result. For example, today in surgery, if you used to been shaved before surgery, they will now clip. Why? Less infections, okay? That's almost 100%. Aspirin to acute MI, almost 100%. But now Virginia Mason, which is probably considered one of the best healthcare providers, is at 74 percentile. So in order for us to be better in healthcare, we're gonna have to reduce variance. Now, let me explain. Congressman Paul Ryan, anybody ever hear of him? Okay, Congressman Paul Ryan and I spent a lot of time in the same town. Congressman Ryan's sister-in-law worked for us for 5 years. Congressman Ryan, grandchildren are in, he's got 3 children, and they happen to all be in a class of my grandchildren. I got two Paul Ryan stories for you. One of them, he's in there's career day at the St. John Vianney Catholic School, and his son Sam, I don't know if did you follow the election at all here in Ocala? Okay, well Sam would come on, and they showed Sam and all the stuff, and Sam's at career day with my granddaughter Katie Grace, same first grade class, and they asked, career day, they said, what are you going to be when you grow up? And Paul Ryan was there, and Sam said he's going to go to Washington and make the world a better place. Why he'd go to Washington. Anyway, so anyway, they got to my granddaughter, Katie Grace. And they said, and Katie Grace, what are you going to do when you grow up? She said, I'm going to be a fluffer in a Build-A-Bear store. Sounds like a better job to me. I asked Paul Ryan the exact question you would ask. Why don't we standardize things more? And he said, we can't standardize protocol, but we can standardize dollars. When you standardize dollars, whether you like it or don't like it, it will force best practices. So if I know that if I use an antibiotic in an ICU, and if I do, there will not be a central line infection, I can no longer not do this. So what you're seeing right now is a tightening up. Now, when you do tell people they have to follow certain procedures, how do people like that? So there's always a little pushback. But what we're finding, sir, is the clinical outcome is becoming so overwhelming, you cannot not do it. Because what we do have is value-driven people in healthcare. So I agree with you. I think we absolutely, in healthcare, have to reduce variance, just like the nuclear programs have done. Are we there yet? Absolutely not. But if you write me an email, I will share with you some organizations that actually are listening to the experts that you're talking about.
One other comment. How can we wait for things to take this?
You know what? Because of my hearing, somebody's going to have to help me.
The statistics are pretty obvious. 100,000 people a year die from infections they get in the hospital. Another 100,000 people die from mistakes. That's a huge incentive not to wait till somebody in the hospital decides I need to do something.
Right.
We need to force this issue. It's
Absolutely.
long overdue.
And the
The
way you
techniques are there.
And the way you force it is you make it transparent. You find out that information and you publish it. I would like every newspaper to publish the statistics for their local hospital. We publish them for our baseball teams. We publish them for our football teams. Why not publish them for our healthcare providers? Because I agree 100%. And the way you have to do that is you have to make things transparent. So, for example, Advocate Good Samaritan in Downers Grove, Illinois, hasn't had a hospital-acquired pneumonia for 4 years. That's where I'd probably go. So I agree with you 100%. And I think one of the ways we do that is with this transparency, and one of the ways you do is there. The other thing, in case you're not aware of it, and it's going to be a little bit of time coming, they're starting to change how they pay healthcare providers. Now, not to go into great detail, but today most healthcare providers have been paid for volume. The more you do, the more money you make. Today, they're withholding Medicare money from hospitals. And they're looking at these statistics, and they call it value-based purchasing. So in the past, they call them never events. And never events are things that should never happen. So you're in the hospital, and I'm not taking good care of you, and you fall, and you break your hip. Well, of course, you break your hip, I would send you down to imaging. Ching. I would now maybe do surgery. Ching. I would actually get paid for that fall. The government's quit paying for those things. So the government is no longer paying for never events, which means you don't get paid. Now, not wrong or right, but the reality is if I'm not getting paid for something, it's going to change. I'm going to try to prevent that even more, because before I got paid for it, now I'm getting reduced. Your healthcare providers today are being penalized financially if they have too many readmissions to the emergency department, if they have too many falls, if they have too many infections. So I actually think it's called, if you go on and look at value-based purchasing, it is getting to be, doctors are being financially disincentivized today for volume, and they're being incentivized for clinical outcomes and value, and that's a real first in healthcare today.
All right, we have time for one more question. I've heard estimates that about 15% of consumers or patients are interested where their doctors went to medical school. The other 85% will just accept the fact that an MD is good enough. And about the same proportion of patients are interested in the hospital that they may go to. Accreditation is good enough for the other 85%. So what are the barriers in preventing consumers in getting more interested in the data that you're talking about?
You know, back to both questions, I'm coming back to the other question too, affections. You know what? We can't change other people. I don't know if any ever tried that. What you can do is change yourself. So what we can, each one of us, is be better consumers. So no, we can't change everybody. We can't fix everything. But by each one of us walking out of this room being a better consumer, that's what we can do. So if everyone in this room worried about it, more people would worry about it. And that's sort of it with the transparency. The other thing I would ask a question, this is another good question. When you go to get health care, ask for their mortality index. The mortality index is a number that you might want to get. Let me explain what it is. If you have a mortality index of a 1 in your hospital, it means those people that should live, and those people that should die. Now, the lower the number, the better. If you have a number above 1, it means certain people that should live die. If you have a number below 1, it means certain people that should die live. How many of you know the mortality index of the hospitals in your area? You can find that out. If not, call them and ask them. And don't let them say, well, you know, it's because we're big, it's because we're here, because it's adjusted clinically. It's adjusted for age, it's adjusted for those things. The other question to ask, and somebody asked me one time in a magazine, if I had one question to ask a hospital, what would I ask it? It'd be, what's your employee turnover? I know this sounds a little crazy, but research shows there's a direct correlation between employee turnover and clinical quality. the lower the turnover, the better clinical quality, because you have a more experienced team working with you and better handoffs. Doctor, do you do surgery? And when you go into surgery, the number one thing you want is an experienced team with you. When you go in and there's somebody you've never seen before, you don't say, oh, is this exciting? A chance to develop a new relationship here. So these are the types of questions you can ask. Because, you know, I wish we could change every consumer out there, but what we can change is each one in this room. The better consumer you are, the better your healthcare providers will be. Have a high bar, and healthcare providers will meet them. Going back to a great place you might want to look at is Covenant Healthcare in Knoxville, Tennessee. One of their board members came from the NASA. He came from a very high level like an IHMC. And he looked at their clinical outcomes and he said to the board, I think we can do better. And they raised a bar. They raised the bar. And even the CEO said, I didn't know if we could do it. But the CEO said, we can, and they did. Of course, they also tied his compensation to it, which wasn't a bad deal. I will tell you that I do believe in healthcare providers. I've known them my whole life. I think they're people that have great purpose, do worthwhile work, and making a difference. No one feels worse when there's a bad outcome than that healthcare provider. But I do think it's a collaborative effort that we should work together. But I did want to do today is give you some statistics so you can be a better consumer. When you go in, you can bring that form. When you go in, you can listen and ask questions. You can go online. You can also ask what your mortality index is and what your employee turnover is. When you ask the difficult questions, you're going to have two responses. Number one is you're going to hear an answer that you like. Number two, you might not like the answer, but the provider will become better. Because isn't that really what we want? The very best health care for everyone? Thank you very much for allowing me to be here.